Welcome to the deep dive. So we've gathered quite a bit of material for you today. Lots of articles, research notes, all looking at these medications everyone seems to be talking about.
Yeah, the GLP-1 drugs and, the related ones. It feels like they're everywhere in the news, online, just general conversation.
Absolutely. And it changes so fast, doesn't it? Keeping up feels like a full-time job.
Yeah.
So this material we have, it covers like how they work, the good stuff, the bad stuff, and how these different brand names actually compare.
Right. It's easy to get lost in the noise. So what we want to do here in this deep dive is kind of pull out the core stuff for you.
Exactly. Cut through it all. We want to give you the essentials from this material, what they are, how they actually function, what they do, and importantly, what you really need to consider.
Think of it like your shortcut to getting up to speed on something that's, well, pretty complex, but also really impactful, all based on the info you've shared with us. Ready to jump in?
Let's do it. Okay, so fundamentally, when we talk about GLP-1 drugs, what are we actually referring to based on the sources?
Mostly, they point to this class called GLP-1 receptor agonists. You'll see it shortened to GLP-1 RAs a lot.
Oh, I see. Okay.
And the basic idea is they copy or mimic a hormone your body already makes naturally. It's called glucagon-like peptide 1.
So they're sort of boosting a natural process, and the material says they're used for certain conditions.
Primarily, yeah. The big ones highlighted are type 2 diabetes, managing obesity, and now there's more and more research into other potential uses too, which we can get into.
Interesting. Okay, let's get under the hood then. How do they work? What's the science making all this happen?
Right, the mechanism. This is where it gets pretty fascinating. The sources lay out basically four main things these GLP-1 RAs do. First, they tell your pancreas to release more insulin.
Okay.
But importantly, only when your blood sugar is actually high. So it's a targeted boost. Helps bring those levels down.
Smart. So it's not just releasing insulin all the time. What's number two?
Second, they suppress glucagon. Glucagon's another hormone, and it tells your liver to produce more glucose. So by turning that down,
you get less sugar being made. Makes sense. Increasing the insulin, decreasing the glucagon.
Exactly. Pretty clever strategy. Third action is they slow down gastric emptying, basically how fast food leaves your stomach.
Ah, okay. So food sticks around longer.
Yep. Which means nutrients get absorbed more slowly, and it also helps you feel full sooner and stay full longer.
That feeling full part seems key for weight management. And the fourth action.
This one's huge, especially for the weight effects. They work on receptors in your brain, parts of the brain that control, appetite and feeling satisfied or satiety.
Right.
So the result is you feel less hungry, more full, and you naturally tend to eat less, which leads to weight loss.
That brain connection, yeah, that really clarifies the appetite thing people talk about. Now, the material also brought up another drug, tirzepatide. It's a bit different.
Yes, exactly. Tirzepatide, you probably know the brand names Mounjaro or Zepbound. It actually takes it a step further. It's what they call a dual agonist.
Dual meaning two.
Right. It mimics both GLP-1, like the others, and another hormone called GIP, that's glucose-dependent insulinotropic polypeptide.
Okay, GIP. So what does adding GIP into the mix do?
Well, GIP also helps with insulin secretion, and it helps lower glucagon, too. So the idea, based on the sources, is that by hitting both these pathways, GLP-1 and GIP, tirzepatide might have an even stronger effect on both blood sugar and weight loss. It's targeting more signals at once.
That dual action sounds pretty powerful. Okay, so let's name names. Based on the material, what are the main FDA-approved drugs in this space that people should know?
Right, looking at the list provided. The big one is semaglutide. That's the active ingredient in Ozempic, Wegovy, and also Rybelsus, which is the oral one.
Those three feel like they're everywhere right now.
They really are. Then you have liraglutide, that's Victoza and Saxenda. There's dulaglutide, which is Trulicity, and some of the older ones like exenatide, which were Byetta and Bydureon.
Okay.
And of course, the one we just talked about, tirzepatide, that's Mounjaro and Zepbound, the dual agonist one.
And the sources mentioned they have different approved uses, right? Like some for diabetes, some specifically for weight loss. And dosing varies too.
Yeah, definitely. You see approvals mainly for type 2 diabetes or chronic weight management. And the dosing schedules are all over the place. Some are once-a-week injections, some daily, some even twice daily for the older ones. And then Rybelsus is that daily pill.
Okay, we get the mechanics now. Let's talk results. What are the actual benefits people see? What does the material say these drugs achieve?
Well, the upsides are pretty significant. For type 2 diabetes, they're definitely effective for blood sugar. The material shows they typically lower HbA1c.
That's the average blood sugar measure, right?
Exactly. Over about 3 months, they lower it by around 1 percentage point for many T2DM patients.
Which is quite good. And did the sources single out Mounjaro here?
They did, yeah. It noted Mounjaro, the tirzepatide one, seemed to show even stronger results in some studies, potentially lowering HbA1c by like 1.9 to 2.6 percentage points.
Wow, that's a big drop. Okay, but the thing that's maybe generated even more buzz is the weight loss.
Oh, absolutely. And the numbers in the material here are, well, they're pretty eye-opening. For the standard GLP-1s like semaglutide, you're typically looking at average weight loss in the 10 to 15% range in trials.
Still substantial.
Very. But then with tirzepatide, the sources consistently show higher numbers, averages often falling between 15 and 22% body weight loss. For a lot of people, that's, 35, maybe 50 pounds or even more.
That's huge.
Yeah, and one source specifically mentioned a head-to-head trial where tirzepatide hit 20.2% weight loss compared to 13.7% for semaglutide in people with obesity.
Okay, those are genuinely life-altering numbers for people struggling with obesity. What about beyond weight and sugar, the heart health aspect?
That's another really critical benefit highlighted, especially for people who already have cardiovascular issues. The sources confirm these drugs can lower the risk of major events, heart attacks, stroke.
And Wegovy got a specific approval for that.
It did. Wegovy, the higher dose semaglutide, was actually the first one FDA approved specifically to cut heart attack and stroke risk in people with obesity, showing about a 20% risk reduction in the studies. Tirzepatide also showed good cardiometabolic effects like lowering blood pressure, improving cholesterol levels.
So the impact goes way beyond just the scale of the glucose meter. And the material hinted at some other potential uses too, stuff that sounds almost unexpected.
Yeah, it's pretty interesting. There's research mentioned looking at reduced cravings, potentially for addictive substances, hints of uses in addiction.
Really?
Yeah. And also data suggesting maybe a lower risk for dementia and Alzheimer's, a possible neuroprotective effect. And they seem promising for fatty liver disease, MASLD, as well.
Wow. So the potential reach of these drugs could be much, much broader than we even realize right now, based on these sources.
Okay, that's the compelling upside. Now, we have to talk about the other side of the coin. The risks, the side effects, what does the material say we need to know? Right, because like any effective medicine, there are definitely potential downsides. The most common ones you hear about, and that the sources highlight, are all related to the gut, the GI system.
And the frequency sounds like it can vary quite a bit.
It really can. Nausea seems to be the biggest complaint, with sources citing ranges anywhere from 30% up to maybe 75% of users experiencing it, depending on the drug and the dose. Vomiting, diarrhea, constipation, those are also really common.
That sounds unpleasant.
It can be, definitely. The sources do say these often get better over time as your body adjusts, and they tend to be worse when you first start the medication or when the dose goes up.
Okay. What about this Ozempic face thing people mentioned? Is that real?
Yeah, the material clarifies that. It's not the drug directly messing with their skin structure. It's more a consequence of losing a lot of weight quickly.
Okay.
When you lose fat rapidly, especially from your face, you lose volume. And that can sometimes lead to skin sagging or looking a bit more aged just because the underlying support changed so fast.
Got it. So it's the rapid weight loss itself, not the drug's chemistry on the skin. Now, the sources also mention some more serious risks. Rare, but serious.
Yes, and these are the ones that need immediate medical attention if symptoms pop up. Pancreatitis, that's inflammation of the pancreas, can cause really severe abdominal pain.
Okay.
Gallbladder problems like gallstones are also mentioned as a risk. Often that's linked to rapid weight loss too, kind of regardless of how you lose it.
And there was a specific warning about thyroid cancer.
This is really important, yes. All these drugs carry a boxed warning warning the FDA's most serious type about a potential risk of a specific kind of thyroid cancer called medullary thyroid carcinoma, or MTC.
So who shouldn't take them because of that?
The sources are very clear. If you have a personal history, or if an immediate family member has a history of MTC, you should not use these drugs. For tirzepatide, there's also a contraindication if you have something called multiple endocrine neoplasia syndrome type 2, MEN2.
Wow. Okay, so family history is absolutely critical here.
Crucial. Also on the serious list, kidney injury. This can happen mostly if someone gets severely dehydrated from bad vomiting or diarrhea.
Right, the dehydration risk.
And tied to that slowed stomach emptying we talked about earlier, there's a risk of gastroparesis, where the stomach empties too slowly or even rarely a bowel obstruction.
That gastroparesis, the slowed stomach, sounds like it could be a problem if someone needs surgery.
Absolutely critical point from the material. The recommendation is strong. Stop taking these medications, usually for 1 to 2 weeks, before any planned surgery that needs anesthesia.
Why is that?
The worry is that if your stomach is still full of food or liquid because it's emptying slowly, you could aspirate that, breathe it into your lungs during anesthesia, which can be really dangerous.
That is vital information. Okay, besides the direct medical effects, the sources also raise flags about safety related to where people are getting these drugs.
Yes, this was a big area of concern highlighted. There are major risks if you get these from unregulated places. One issue is compounded versions.
What does that mean, compounded?
It's when a pharmacy, maybe, or lab mixes up a version of the drug themselves, outside the official FDA approval and manufacturing process. The sources warn these can have the wrong dose, inconsistent ingredients, maybe contamination, and they've been linked to serious problems, even hospitalizations like for pancreatitis.
Okay, so definitely avoid those. What about counterfeits?
Even scarier, potentially. These are fake products sold illegally, often online. They might have the wrong drug, no drug at all, or even dangerous ingredients. The material basically screams, do not buy these from sketchy online sources. Only get them with a proper prescription from a licensed pharmacy.
Got it. And there is something about off-label use risks, too.
Yeah, using them for reasons they aren't approved for or in people they haven't been studied in for that purpose. Like the sources noted, if someone who isn't obese uses them just for cosmetic weight loss, they might face higher risks, especially things like severe dehydration if they get bad side effects.
And definitely not for use during pregnancy.
Unequivocally, no. The sources state they are contraindicated, absolutely should not be used during pregnancy because of potential harm to the developing fetus.
Okay, crystal clear on that. Let's zoom in now on the big players everyone asks about. Ozempic versus Wegovy versus Mounjaro Zepbound. The material had some really good comparison points.
It did. It's helpful to break them down. Let's start with Ozempic and Wegovy. Key thing the material emphasizes, they're the exact same active drug, semaglutide.
Same medicine, but different names, different uses.
Exactly. Ozempic is primarily FDA approved for type 2 diabetes, and importantly, it also has approval to reduce cardiovascular and kidney risks in people with diabetes.
Okay, diabetes focus for Ozempic. Wegovy.
Wegovy is approved for chronic weight management. That's for adults and even adolescents, 12 and up, who have obesity or are overweight with a related health condition. And like we mentioned, Wegovy also got that specific FDA nod for reducing heart attack and stroke risk in people with obesity.
So, same drug, but Wegovy is specifically targeted and dosed for weight loss and its related heart risks. Speaking of dose, that's different too.
Big difference, and it explains a lot. Ozempic for diabetes goes up to a maximum dose of 2.0 milligrams per week. Wegovy for weight management goes higher. The maintenance dose is 2.4 milligrams per week.
Okay.
And the sources explicitly state this higher dose in Wegovy is what drives the greater average weight loss, but it's also why it tends to come with more side effects.
Makes sense. More drug, potentially more benefit, potentially more hassle.
Yeah.
Do the weight loss numbers reflect that dose difference?
They do. Ozempic, at its typical diabetes doses, usually results in more modest weight loss. The material mentioned may be around 10-14 pounds at that max 2.0 milligram dose. Wegovy, at the 2.4 milligram dose, shows those higher average weight loss percentages in trials, like 15 to 17.4% of body weight. That often works out to about 35 pounds on average.
Okay, so Wegovy definitely packs a bigger punch for weight loss, directly linked to that higher dose. And the side effect comparison really drives home the dose impact too.
It really highlights it. The material gave specific percentages comparing Ozempic 1.0 milligram, a common dose for diabetes, versus Wegovy 2.4 milligrams, the weight loss dose. Nausea, about 20% with Ozempic 1.0 milligram, jumps to 44% with Wegovy 2.4 milligram.
Wow, double.
Yeah. Diarrhea goes from maybe 10-15% up to 30%. Vomiting from around 5-10% up to 24%. Constipation also roughly doubles from 5-10% up to 24%.
So quite a bit more common.
Definitely. The serious risks, though, like the thyroid cancer warning or pancreatitis risk, they're considered the same because fundamentally it's the same medication. Just more chance of the common stuff at the higher dose.
So trade-offs. More weight loss potential with Wegovy, but a significantly higher chance of dealing with those GI issues. What about cost and getting access?
That's a huge factor for most people. If you're paying out of pocket, the sources suggest Ozempic is around $900 a month, while Wegovy is more like $1,350 a month.
Big difference.
Yeah. Insurance is much more likely to cover Ozempic if you have diagnosed type 2 diabetes. Getting Wegovy covered for weight management often requires specific BMI criteria, proof of related health issues, and even then, insurance coverage is notoriously inconsistent. Plus, both have had major issues with shortages, making them hard to get consistently sometimes.
Okay, that clarifies the Ozempic-Wegovy picture really well. Now let's switch to tirzepatide, Mounjaro, and Zepbound, the dual-action one.
Right, the GLP-1 and GIP agonist. And the material consistently points to its potential for, well, superior efficacy compared to just the GLP-1s alone.
And how does that show up in the actual results reported?
Both for blood sugar and for weight. For diabetes, the sources mentioned those higher HbA1c reductions we talked about, potentially 1.9 to 2.6 percentage points. And for weight loss, the studies consistently show really impressive numbers, often in that 15-22% average body weight loss range. Remember that head-to-head obesity trial result? 20.2% loss with tirzepatide versus 13.7% with semaglutide.
So the takeaway for the sources seem to be, if maximum impact on sugar or weight is the absolute top priority, tirzepatide might be the strongest contender among these. How do its side effects compare?
The types of common side effects are very similar: nausea, diarrhea, vomiting, constipation. The percentages listed in the material seem roughly comparable to, maybe slightly lower than, the high-dose Wegovy 2.4 milligram, but generally higher than Ozempic at its lower diabetes doses, like nausea around 22%, diarrhea 17%, vomiting 10%, constipation 10%.
Yep.
And the advice for managing them is the same. Start low, increase the dose slowly, eat smaller meals, stay hydrated, maybe avoid super fatty foods. And again, they often lessen over time for many people.
And the serious risks for tirzepatide, anything different there?
It has the same boxed warning about medullary thyroid carcinoma history. Pancreatitis, gallbladder issues, kidney injury risk are also listed similar to the others. One thing the material noted specifically for tirzepatide is a potentially higher risk of hypoglycemia, low blood sugar, especially if someone is also taking insulin or another type of diabetes drug called a sulfonylurea. So careful blood sugar monitoring is extra important in those cases.
Good to know. What about getting tirzepatide? Access and cost.
Prescription rules can definitely vary. The sources mentioned examples like the UK having quite strict criteria based on BMI plus other health conditions, while in the US and EU, it generally follows approvals for T2DM or obesity overweight with a comorbidity. Cost-wise, if paying cash, it's in that same higher tier as Wegovy, around $900 to $1,350 a month, typically.
And shortages.
The material indicated that, at least recently, tirzepatide, Mounjaro Zepbound, hasn't faced the same persistent widespread shortages that have plagued Ozempic and Wegovy, which might be a practical factor for some.
Okay, so putting it all together based on the sources, how might someone, guided by their doctor, of course, think about which one might be right?
Well, the sources kind of suggest a framework. Ozempic could be a go-to if you have type 2 diabetes and could also benefit from some weight loss, especially if insurance covers it best under the diabetes diagnosis.
Makes sense.
Wegovy seems positioned for people where obesity itself and maybe associated heart risk is the main target. You get that specific cardiovascular risk reduction approval for obesity, and the higher dose aims for maximum weight loss, accepting the higher side effect potential.
Okay.
Tirzepatide, Mounjaro Zepbound, looks like the choice if the goal is really pushing for the highest level of effectiveness, either for blood sugar control in T2DM or for achieving the most significant weight loss based on the trial data cited.
And what about liraglutide? Saxenda.
Yeah, the sources mentioned liraglutide, Saxenda, as another option, perhaps offering more moderate weight loss, maybe in the 5–10% range, potentially with a different side effect profile for some. It's usually a daily injection, unlike the weekly ones we've mostly discussed.
That really helps map out the landscape based on the material. Okay, shifting to practicalities for people actually using these, what key takeaways came up?
The number one thing emphasized across the sources is starting low and going slow with the dose. That titration, increasing it gradually over weeks or months, is absolutely key to letting your body adapt and minimizing those GI side effects.
Don't just jump to the highest dose.
Definitely not. Regular monitoring is also important. Things like checking kidney function periodically, thyroid monitoring as discussed, and just making sure you stay well hydrated, especially if you were having GI issues.
And that surgery warning again.
Cannot stress it enough based on the material. That advice to stop the medication 1 to 2 weeks before anesthesia is a critical safety measure to prevent aspiration. Patients must tell their surgical team they are on these drugs.
Very important. Can people take these with other meds? like for diabetes.
Yes. The sources note they're often used effectively in combination with other common diabetes drugs, like metformin or SGLT2 inhibitors, to get even better blood sugar control.
Anything else on the practical side?
Just a brief note in the material about being aware of and monitoring for any potential changes in mood, like depression or suicidal thoughts. It was mentioned as being rare, but something to keep an eye on.
Okay. We've covered a ton how they work, who the players are, the really impressive benefits, the significant risks, the key differences, and practical tips. What's next? What does the future hold for these kinds of drugs, according to the material?
Well, development is definitely ongoing. We already have an oral GLP-1, Rybelsus, but the sources mention research into other types of oral agents, even non-peptide ones, which could mean more options down the line that don't require injections for everyone.
That would be a big change for usability.
For sure. And the potential uses just keep expanding. Studies mentioned are looking at these drugs for things like PCOS, polycystic ovary syndrome, binge eating disorder, even potentially treating heart failure.
So the story is definitely not over yet. This class of drugs could become even more central to treating various conditions.
It really seems that way, based on the direction of the research highlighted.
All right, let's wrap up this deep dive. We've really unpacked this stack of material on GLP-1s and related drugs for you.
And I think the clear picture from the sources is that these medications are a genuinely significant advance. They offer really powerful benefits for type 2 diabetes, for obesity and weight management, and for cardiovascular health. Plus, there's all this emerging potential in other areas like addiction and neuroprotection.
But, and this is a big board, but running through all the material, they are powerful drugs with real risks. Those common GI side effects can be tough to manage for some. And the rare but serious risks, pancreatitis, the thyroid cancer warning, need careful consideration and patient selection.
Absolutely. And the need for proper medical supervision, getting these through legitimate channels, cannot be overstated. The sources are emphatic about avoiding unregulated, compounded, or counterfeit versions because the dangers are just too high.
Right. So whether you're thinking about these for your own health journey, trying to understand what's happening in healthcare, or just making sense of the news cycle, hopefully digging into these details helps you see beyond the simple headlines. You're definitely better equipped now.
And maybe that leaves us with a final thought to chew on, something really provocative from reflecting on all this material. Given how dramatically these drugs are already changing the game for metabolic health, and with these hints of potential in areas like brain health and addiction, how might they fundamentally reshape our approach not just to medicine, but to well-being, maybe even society itself, in the years ahead? What does this constant tightrope walk between incredible benefits and serious risks really tell us about where medicine is heading?